Good morning. This is Dr. Yogesh, HOD, Department of Physiology, Sri Chamundeshwari Medical College Hospital and Research Institute, Channapatna. Okay, so in this video we are going to learn about the motor system. So in the motor system, first is the bulk of the muscle. Okay, so by inspection you can just try to see, compare on both the sides for the bulk, and in a more in a quantifiable way, take a tape and measure it. And I hope you know that for measuring you have to take the maximum girth, where the girth of the muscle is maximum. Take the measurement over there. Once you've taken a measurement, on the opposite side you should take it the same spot. How to do that? Take the, for example, let's say if I have decided this is the maximum girth, from the nearest bony point I am going to measure what is the distance. Let's say the distance is 6 centimeters. I will come here, same bony point, 6 centimeters. Now I am going to take the muscle's girth. So that is how you have to check for the bulk of the muscle by inspection and palpation. Tone of the muscle. For tone of the muscle, you can choose any joint. Let's say, for example, if I want to check at the elbow joint, I am going to support the joint. Now I am going to passively move it. Because I am actively doing it, patient is doing passively. I am just moving and seeing. If the tone is increased, you will be noticing that it is not so easy to do that. You are going to feel a kind of resistance. So this is how we check the tone of the muscle. Next is the power of the muscle. For power of the muscle, you can check in groups. You have to check almost all the muscles in the body. I will just show a couple of them. For example, if you want to check the power of the flexors. So now what you do, the biceps, what it will do, this is its action. So what I am going to do is I will tell the patient that, sir, you should try to fold your hand, but I will stop it. Okay, please fold your hand, fold your hand, fold. See, I am trying to give a resistance. That's how I check the power of biceps. If I want to check the power of triceps, what is the action of triceps? Extension. Okay, so now I will tell the subject, sir, you should try to extend your hand, I will try to stop it. Okay, extend your hand, extend. So for all the muscles, similarly you are doing it. Just try to give an opposing force depending on whatever action it is having. For example, if you want to check the flexors of the hand, sir, hold my fingers, don't allow to remove it. See, I am trying to remove it, he is holding it. So this is how we check for the flexors. So like that, just look at I cannot do all the things in this small video. I have just shown the two muscles. Always do bilaterally on both the sides. And for the power of the muscle, it is a must that you should know the grading of the muscle. Normal grading is 5 by 5. You have to know what is 0, 1, 2, 3, 4. So just learn about it. After that, moving to the coordination tests. First we are starting with the finger nose test or the finger nose test. So in the finger nose test, what we instruct the subject is just outstretch the hand with the tip. The tip should come and touch the nose. Ask the subject to do this 2 or 3 times. Then you ask him to close the eye. Even with the eyes closed, a normal person can be, he will be able to do it. Sir, stretch the hands, touch your nose, go back, continue, again, continue, keep doing it. Close your eyes, continue. So even with the closed eyes, he is able to relax, to touch this is the finger nose test. In finger nose test, what happens is, the person is going to, sir, touch my finger. First keep your hands outside, touch my finger, touch your nose, again outside. Repeat, open your eyes. Continue. So this is the finger nose test. So next is test for disc diadochokinesis. Okay, so in this, what happens is, we ask the subject to perform a fast alternating movement. So you have to do this one, turn, flip your hands, again repeat. Again flip. Flip your hand. Repeat money. Okay, so the idea we have to try to explain the patient if they are not understood. The movement should be first flip it, again flip it, again flip it, again flip it. This is what we are going to test here. Okay, next is rhombox test. In rhombox test, sir, please stand up. Both the feet together. Okay, so whenever you are doing this test, always you have to stand behind the patient, because sometimes when you ask the person to close the eye, there's always a chance it's going to fall and hit their head towards something. Okay, so sir, close your eyes, sir. Okay, open your eyes, sir. Okay, if at all there is an ataxia, you are going to see a small sway. And some school of thought is that instead of standing straight, they tell to keep the hands stretched and stand up. Because the smallest movement also, you will come to know it's more prominent. You can do either way. These are two different schools of thought. Okay, in cerebellar ataxia, what happens is, even when you keep the eyes open or closed, they are going to sway. But in sensory ataxia, when the eyes are open, they'll be able to stand straight without any problem. The swaying will happen only when the eyes closed. That happens in sensory ataxia. Along with this, we have the knee heel test and the tandem walking. So in tandem walking, what we do is we ask the person to walk on a straight line, such a way that the toe and the heel to toe, heel to toe, heel to toe. Okay? Try, sir. Yes. Yes, sir. Continue. Okay, no problem, sir. Yeah. So that is the tandem walking. Okay. If you want to examine the gait, many of the times when the subject is entering into your consultation chamber, you would have noticed that time itself, or you can ask them to have a small walk. You can observe the gait. So the knee heel test here, what we do is we ask the subject. You can do this in a lying down position, also in sitting also. So we ask the person to use the opposite leg, take the heel from the knee. They have to run down on the shin in a straight line. Sir, with the opposite leg, the heel in the ಮಂಡಿಯ ಟ್ರೈಟ್ ಕೊಂಡು ಸ್ಟ್ರೈಟ್ ಆಗಿ ಥ್ರೆಡ್ ಆಗುತ್ತೆ. ಆ ಕಾಲದಲ್ಲಿ ಹೋಗಬೇಕು. Okay, so this is how we do the knee heel test. These are the tests under the motor system. Thank you.